I think we had a very very rich discussion so far, starting with Olivier, where he advocated that we need to have a game plan, an ex-ante game plan of how to finance. And really, I think he demystifies that one instrument is not really the solution, but you need to combine various instruments depending on the circumstances. But the important is to have a game plan and to have a toolbox of instruments that are not mutually exclusive. The GAT bonds, insurance, contingent lending, actually they fit better together than having to choose one or the other. And then we went and we spoke about the parametric nature of insurance, that this is one way to reduce admin costs and to make something much more transparent to everyone on when the insurance pays out. And then it was very interesting with Simon's example on ARC, where we have countries like Niger and Mali that are very poor countries, and yet they're paying premiums and they have the concept of insurance for catastrophic drought events. So that gives us basically a good leadway that the pandemics can be received the same way as the severe droughts that have a devastating impact in these countries. And then I think we talked about the certain uncertainties. How do you price this insurance? The type of data that you need. So I want to open the floor. You see, we have a huge gamut of discussions here. Yes, please.
Thank you. This is really interesting. I guess when I think of insurance and the risk side of it, I guess my crude way of understanding that risk sometimes is about also the recoveries that insurance companies need. And in that, insurance premiums, if there's zero recoveries, are going to be quite high, but if there's some recoveries, you'll be able to keep them a little low. And in this plan, is there an expectation that there's going to be recoveries from the countries themselves or donors? That's the A question, just to understand. And that points to the B question in my mind. And I'll be honest, I'm not an insurance expert by any means, so I had to literally do a quick Google search to find out what is parametric insurance actually, and I came away with just two things. One, it's a rare yet intense event, and the payments happen ex ante rather than at a loss, which started to paint a slightly different picture for me, in that with the flexibility that's being asked of these different funds, essentially that small amounts of money, sometimes cash flow needs to flow out, the insurance that's going to be put in play, all of a sudden, if it actually does need to be drawn down quite frequently for these countries, at some point it starts to smell and look a lot like a banking solution, but much more expensive. And I just want to understand if that is something that's being thought of, essentially, that maybe it's not just one solution and insurance only, but you need other things to play, especially when we're hearing from the audience that we need to not talk about big flows of money coming out at epidemics. We need to also have small chunks of money come out on a very regular basis. And it's a question mark in my mind whether or not insurance is actually the appropriate thing for that.
I think Olivier has started answering this, where he said, you need reserves, you need to have something else, your savings account on a personal level or reserves at the country level for this more frequent events, and insurance comes from the very catastrophic level. Maybe, Olivier, you want to elaborate on this point?
I mean, as you said again, and Nikhil and others may want to jump in here. You're right, and the frontier between banking and insurance sometimes is a bit loose. So I think we've been using, to some extent here, insurance in a broader term. This is why I prefer the term of disaster risk financing. That may include insurance, but other tools. And definitely for recurrent events, 1 in 5 years, they're not catastrophic events by any means. So also we need to define what we mean by catastrophic events. Initially, parametric insurance was designed for extreme events. Some facilities like the ARC now are trying to push down the notion of disasters to 1 in maybe 5-10 years. So it's still catastrophic or not. And then the question, of course, is whether this kind of insurance product or solution is the only solution. And when you do your math and some sort of cost-benefit analysis over a long period of time, this may be or this may not be. And from a government perspective, when we work with governments, we try to give them the kind of tools, again, to to assess, in fact, those different tools. But definitely for recurrent events, starting from the bottom, as I said, you may want to have other sort of products before you go into insurance. And also this is for the benefits of an insurance companies, because in any product, whether it's parametric or not, you're going to have a deductible. So what happens when you pay a premium, but your loss is still significant for you, but not enough to trigger a payout simply because you're below the deductible, which is the worst case scenario. You pay a premium, you don't have a payout, and not even parametric insurance. So how are you going to finance it? And again, the experience we have with countries that at the end of the day, they want a blanket solution. They want to make sure that whatever happens in their country, they want to have something, some sort of financing, whether it's insurance, whether it's budget, whether it's contingent credit. For them, it's kind of, I would say, financial engineering. From a political perspective, they want to make sure that they can stand in front of their population or in front of their parliament and say, yes, we have funds to finance what is needed at that time, whether it's small amount or whether it's a large amount.
Could I maybe add one comment? Sure. I think also coming from a capital markets background, I think Olivier touches a good point. The instruments, it's a combination, and there's a blend between the two. But I think there is one absolute critical distinction between insurance and basically loan type or banking products. In the end, credit products, banking products look at the ability to pay back, creditworthiness. Insurance products look at risk. That's a completely different window. So if you look at the pandemic example, would private banks be willing to lend to, I don't know, Liberia to cover their pandemic response costs? Maybe, maybe not. But how do you securitize that loan? That's a very open question. Versus private insurance companies who, with the right modeling, are absolutely willing to take on using Liberia as an example, pandemic risk, because it's looking not at their credit worthiness, but on the risk modeling and whether then the premium, the recovery, as you say, is adequate to cover the underlying risk. So that's the difference, I think, in the window. And of course, insurance is then focused on the mitigation to reduce the risk versus the credit worthiness aspect.
Let me go to, yes, Juan.
Thanks. Yeah, Juan Costain from the World Bank. Just a question. I'd like to hear people's views on the role of insurance, and particularly pandemic insurance, and two things that make pandemic insurance very different. I mean, one is that, distinct from a drought or an earthquake or something like that we're looking at a public bad, so that if you have an earthquake, it's your country that suffers and you need the money to rebuild. When we're looking at a pandemic, most of the costs, in fact, also come from, the economic costs come from behavior change. So the costs are not actually incurred in the country where the event takes place, but the costs are incurred elsewhere. And so just in terms of looking at insurance, and particularly the cost structure of insurance, we're talking about this as if we're insuring Liberia. Nikhil just mentioned particularly Liberia, whereas in fact the beneficiaries of the insurance are going to be the United States, the European Union, and so forth. And they have a very different cost structure. So I'd like to hear the views on that, because really, the people going to be paying are going to be essentially the donors, and they're going to be ultimately the beneficiaries, but we're centering it around particularly the IDA countries where the event takes place.
José?
Yes, I think this question is quite related to the previous one, because for earthquake or typhoon or whatever, it is it's very simple, say, to identify what is the value of the exposed. It is simple to, thank you. It is simple to identify the sum insured. You see, but in the case of the pandemics, it is necessary to identify what is the subject matter of the insurance. For which purposes is the insurance purchased? Maybe it's for emergency costs to alleviate the cost, or maybe it's to help with some income, extra income to the people affected, or maybe for the orphans. I don't know. So this is a very important basic topic to be discussed, I think, and this is in the core of the potential coverage.
Simon?
One of the really interesting things about parametric insurance is that you're not tied in the same way as you are in indemnity insurance to an actual loss. And so if you look at it more as a derivative, then you have a triggering event of some level of pandemic outbreak. But for drought, for example, we pay out effectively against modeled drought response costs. So that's a response cost per person. And then we model out how many people we think are going to be affected by a particular low rainfall situation based on the rainfall data, and a lot of other things in between. But I'm not an insurance person. and I feel like I can only talk really about parametric insurance, but one of the things that really appeals to me about parametric is that you can address indirect costs. So you can structure a product which does respond to, okay, what's going to be the cost of putting in place the surveillance and immediate response system that you need if you start to get an early outbreak, and then and just trigger that. And I was going to. So the earlier question as well, one of the other things that you can do with parametric insurance is not even contemplate what the full cost of a particular event is going to be. You don't necessarily need to model all of that out. You can buy a parametric insurance, as José just said, just to cover the emergency costs over, let's say, a 3-month period. So a response cost over a 3-month period, that's a much easier, much more tangible thing to model out, and therefore to assess the risk of that happening, and get the payout for that. So you're not paying out against the totality of the risk, the pandemic once it's gone global. You're much more, you can be much more constrained in that, and that makes it a very useful tool, I think.
Thank you. I have 2 questions. The first one is the following. Which countries would be included? And this is an important question because every country in the world is subject to some sort of catastrophic event. Perhaps there are different, but all of them are at risk. And related to that, if that is true, then the premium would be calculated based on the individual risk of countries or based on the pooled risk?
I'll start with that from a Africa risk capacity perspective, which is an African institution dealing with the African Union members. And we, for the drought insurance and for other insurance that we might offer in the future, each individual country would be buying the policy, would be assessed. So a particular country's vulnerability to, at the moment, to drought, but to pandemic risk would be assessed, both in terms of outbreak and in terms of infrastructure to contain that outbreak. And they would pay a premium which was related to that risk, but brought in the value of the fact that you have all the other countries in the pool. I run the financing vehicle for African Risk Capacity, which is an insurance company. It's capitalized. We use the international reinsurance markets to bolster that capital, but we offer the prices to the countries which are the best possible price, taking into account that diversification across Africa. But also it's a risk-related price, so it's not the same price for everyone. It is, and through that you can incentivize the kind of behavior that Nikhil was talking about in terms of building that resilience. You could recognize that in the premium cost because your premium it's risk-based premium. So as you build out your resilience, for example, then your premium cost is going to reduce, and you can recognize that in the way that you structure the product.
So, sorry, I just need to follow. The thing is that is theoretically true, but it goes against the principles of solidarity, because and that is a big issue from a public health perspective, because basically you are the countries that need more and that are more affected are paying more because they are paying on an individual basis, and then.
Maybe I could contribute here, at least in the context of the pandemic emergency facility. I think there are 2 parts to it. One is how is kind of the protection board, how is the financing done, and that's on a pool basis, because we're talking about a risk here that, as many people have alluded to, is effectively global in nature. It's shared. But separately, I think what you want is to, again, coming to the whole purpose of insurance, versus, again, complements that are more credit-focused, is to give clarity on the risk of individual countries, which is separate on how you then charge countries premium. So again, if you think about your group life insurance policy, if you work at a company or many of the institutions you work with, no one is coming and saying, well, you're a smoker, you're a healthy person, you've been eating, Nikhil, too much Indian food, and therefore your insurance premium is higher. We pay one cost for all the employees in the pool. But at the same time, what I would value as an individual is to know, even within that pool, how my risk behavior factors into my insurance cost or my pooled insurance cost, so that I can make better behaviors which are better for me. So I think it's a separation between pooling the risk so that you get the most efficient premium and giving clarity on risk benchmarks so that individuals, or in this case countries, can make very strong decisions on how to reduce their risk.
I saw that Gunther wants to add a point here.
Yeah, Nikhil partly addressed it already, but I think it really comes in this context, and that's slightly different from how Simon describes it for the separation between premium payment and payout of the loss. Because where you clearly want to have the risk focus, that is the premium payment, because you want to have the incentive given to countries to be better prepared. However, in this context, you clearly do not want to kind of limit the payout in the same way to a country-by-country basis, because containing a pandemic or epidemic outbreak obviously does not or should not stop at the border of a country. So to that extent, and it relates to a question of the governance of the pandemic emergency facility, how to structure the payout so that by paying your premium, you pay being part of the pool, but then the loss payment or claim payment used to contain the outbreak is then, of course, not only paid maybe to countries directly, but also to the international organizations to really be active in where it is necessary to contain the outbreak.
And so that Martin.
Thank you. If I may, I'd like to disagree quite strongly with this idea that it's possible to have a parametric insurance vehicle or tool for pandemics. Pandemics and infectious disease events are not, I put to you, like droughts, floods, or hurricanes. And one reason is that they're more irregular in pattern, and they're far more difficult to estimate the potential event. 20 years ago, I tried to, when I was young and naive at CDC, I estimated and published some estimates of actuarially fair premiums for the US to pay for bioterrorism and pandemic preparedness. Nobody was interested in them. What they were interested in was the estimates of potential impact in terms of cases, hospitalizations, and deaths. And I'm happy to say they took those numbers and were the basis for a set of initiatives that over time in the US we have become much better prepared to respond to both pandemics and bioterrorists and other infectious disease events. But they didn't buy what you'd think of as an insurance product. What they've done is they've built stockpiles of material, they've trained, and they also invest a lot of money into research for improving technologies. And in fact, if you look at 2009, and if you bought an insurance premium for 2009 based on the three pandemics of the 20th century, you would have vastly overpaid the premium, because what happened in 2009 is what nobody knew about. For some reasons that we don't still understand, people over 60 were largely protected from exposures in the 1950s, for heaven's sake, and they did not die off or get ill in the rates that we expected, which is a good thing. But if, again, in terms of insurance premiums, the product would have vastly failed. So the question I have for the panel members, and with respect, I do say this, I understand where you're coming from, and it's not necessarily a bad idea, but the big problem is assessing the probabilities of these events. Because we really don't know how influenza changes from the point where it is transmissible and its lethality and its clinical impacts. Very hard, very difficult. You can get yourself a Nobel Prize if you work it out. How comes the next pandemic? What is the strain? Why hasn't H5? And it's not just influenza. What about MERS and SARS? So what do we do when you can't really be very good at estimating the future risk, unlike with a drought or a flood?
Nikhil?
Maybe I'm obviously not an expert in medicine and probably in the wrong form, but I will say this. I was reading a very interesting article after the 1906 earthquake from our archives, and it was talking about the fact of, was earthquake insurable? I think there are plenty of people in this room who may disagree on the modelability of pandemic and parametric insurance for pandemics. But what I definitely would venture to say, and here I'll speak on a project Simon and I worked on. A couple of years ago, we thought about doing extreme rainfall coverage for poor female entrepreneurs in Haiti. And at the time, everyone told us absolutely impossible. And for people who've had the chance to speak to those female entrepreneurs, they would say, no, it was totally possible and our insurance premiums were worth it. So I think where I'm going is, I don't think drought and earthquake are that well understood. If you speak to people in this room who work in those fields technically, they would argue that it's equally challenging. Do we understand exactly how drought patterns behave, particularly with climate change? The answer is absolutely not. But we do have a sound enough basis for commercial companies to be willing to put their money and their shareholders' money at risk. And I think you have the same thing here with pandemic insurance.
Maybe I can jump in as well with a comment, because I think one needs to distinguish two challenges. One challenge is to predict the next event, and the other challenge is to give a general probability of occurrence. And insurance does not answer the first question. And insurance would terribly fail in doing the first one, because, as you say, the next influenza is very different from the last one. We can't tell when and where the next event will happen. But what we are trying to do is to give a generic subset of events. And if you look at the historical outbreak events, and that is more than the three, there is quite some pattern in it. And to stick very closely to your example, to know if we overpaid for this current century is actually still an open question. Like just on the first event of the century, it's very hard to judge what is generally still to be expected to come in the next few remaining years of the century. But again, we need to give a price tag for a general risk and what to do with it. We do not need to predict the next one.
And Martin, I think this bodes well for our panel discussion this afternoon, because I'm going to violently agree again on top of that. And I think part of it is I've spent my life doing monitoring and modeling of epidemic threats and a lot of surveillance. And I do think that we have to defend the surveillance community a little bit, right? The reality is none of the measures for any of these catastrophic risks are perfect. And if we look at the last 20 years and the nature of our capacity to do effective monitoring, do we get resolution down to exact case counts? No. But if you look at the kind of things that Jordan was talking about earlier and the initiatives that are happening, what USAID has done, DoD, CDC, the nature of surveillance systems have increased dramatically in their quality over the last 10 years. We know where open spots are. We can rank countries in terms of the significance of particular case counts. So I think we should give surveillance a little bit of credit. The other thing I would say is implicitly, these epidemic risks are already being insured. They're already being calculated, the risks. Whether it's explicit or not, all of your insurance companies are holding epidemic risks. Us as society is holding these epidemic risks. And the notion that we shouldn't try to more fluidly move them around, I think, is a mistake. I mean, my particular perspective is that rather than sort of focus on any one particular approach, that this should be sort of let 1,000 flowers bloom. There should be many, many different ways, whether you're a corporation, an individual, a country, to have better capacity to manage and transfer these risks around. And I think the interface with sort of those of us who have spent our life monitoring will give us a different approach. Anyway, we'll continue more this afternoon.
I saw, yes.
Thanks. I just want to add a couple of points. Just from my own experience working in developing countries with this insurance question, it's really difficult for the Ministry of Finance to actually pay for insurance for their citizens and for warehousing and for other basic infrastructure. To get them to pay for something like this, I think it's a stretch. It's a real stretch. And to the point of the life insurance hedge, a lot of people on the ground don't actually have life insurance, so I don't know if that's relevant to the targeted audience that we're talking about here, but it might be. I don't know. But I think the question is then who's going to pay for the premiums, and if it's the companies or the corporates, then they're going to have their own sort of risk profile that's different than the overall country because they have business, not necessarily everyone works for them. So this kind of takes us back to the original question or the original conversation, which was if there's money available for kind of quick response and to take care of these pandemics, then where does the money come from, that long sustainable sort of premium payment? And I still don't understand that.
I think there are a couple of things, and maybe I can call Simon to talk, because we saw on drought very poor countries where they're beneficiaries of donor aid when the drought comes, yet now they are willing to pay for premiums. And on the life insurance, the situation actually it's quite changing. Pretty much all the microfinance institutions now they have what is called credit life insurance. So if anything happens to the person who borrowed, then the loan gets basically repaid through insurance. So it's not really life insurance, but it's what is called credit life insurance. It pays for, and this is actually, even among poorer households, is embedded into the loan for 40, 30, 50 base points. You have it bundling into the loan automatically. So a big mortality will have an impact, particularly on microfinance institutions that they try to make inroads in these countries. But maybe, Simon, your experiences in Africa.
I mean, I'd actually first pick up on that point that if you look at insurance growth in Africa, for example, I don't know what the percentage is, you probably do, but I mean, it's massively skewed towards credit life at the micro scale, and that's where it's going to stay almost certainly. And you would be very surprised about how much risk is embedded in those micro policies for pandemic risk. But there is also obviously the huge volume in if that pandemic risk made a step into the Europe, into the US, etc. On the government's paying premium, I mean, I've been doing this for quite a while now. And a lot of what I've been doing is knocking on ministers of finance's door and talking to them about why this is a useful thing to do, and giving the countries some control over their how they respond to disasters is a big part of it. I should just mention that African Risk Capacity is actually a mutual insurance company. So the mutuality that was questioned earlier about that risk-based premium costs is actually the mutuality is found at the insurance company level. So all of the African countries who buy insurance are members of the mutual. So, but it is a hard sell for sure. It's not easy at all. But certainly on the humanitarian financing side for drought, for example, in Africa, I think there are many of the countries in sub-Saharan Africa who are very keen to start to own some of the response and to get help to do that, and they're prepared to pay a premium to get that support.
Past life, I helped governments hedge risks around kind of oil price and natural resource price shocks. And you're right, getting them to pay what is essentially, and the Mexicans have done this very well, but getting them to pay, what is essentially a put option premium in order to hedge against downside risk on oil prices is very hard for the Ministry of Finance to do. But sovereign wealth funds, who are kind of tasked with that responsibility of providing budgetary stability, can then, make better use of these kinds of derivative products. So I think maybe there is something, or a question is there maybe something to setting up an entity with that responsibility that can then, use the full toolkit of financial products in terms of financial engineering. And I guess a kind of a second question to that is, and I was going to ask this after the last panel, but we ran out of time, is, why is it that donors are not actually using these leveraged products to a greater extent? And so in these funds, in the new WHO fund and the new World Bank fund, I would think that, a portion of these monies might go to and let's not talk about banking versus insurance. Basically, it's a wrapper, it's a premium, it's some kind of financial engineering product that gets you leverage. And so just wondering your thoughts about that.
Yeah, Nikhil? Yeah.
I think two comments. First is, it's absolutely, I think you characterize it the right way. It's a put option on risk. And the dialogue and where it's, I think, really taking off, and I know we talked about, do we have enough people with Ministry of Finance background in this room? And if you talk to them, one of the things they view is that covering these risks through basically loan-based products consumes fiscal space. And let's not forget that in the end, that is the absolute critical criteria for finance ministry officials. And I don't know if people have read the reports from the rating agencies on the countries that were affected by Ebola, but it's quite startling, the threatened rating agency actions. And thank you, to the IMF and others who took action there. Insurance doesn't consume fiscal space, which is why many institutions are looking at using it. And you asked about an institution that I think does this well. World Bank Treasury has, and we have some people in the room, have dramatically expanded what they're doing in this field and moving from the earthquakes to things like drought to things like the combination of drought and energy prices. And then I think to your second question on donors taking note, I think the G7 under Germany's leadership, and I think the people at Munich were involved also in the discussions there, have made some very bold statements on the plan to use these hedging instruments as a better way to leverage their finite donor funds.
Yeah.
Sorry, Panos, could I just on that final point, ARC is actually in discussion with some donors about doing exactly that, basically replicating the ARC portfolio, which is country purchased, for donors to supplement response for droughts. So I think within the next, probably not until the World Humanitarian Summit, but probably there will be some announcements about donors actually using these instruments directly.
Thank you. I'm Jennifer Adams. I'm here from the U.S. Agency for International Development. While we were talking, I looked up that the amount that the U.S. government has spent last year and this year on Ebola response is $1.9 billion. So that's a lot of money by anybody's book, and I think we're very interested in this discussion and in concepts and proposals that would help to better prepare and respond. So I just have a few questions about linking the concept of a pandemic emergency fund and the insurance premium concept to a couple of things. And one of them is preparedness, because it seems like that's one of the aspects that would need to be in place for these schemes to work in any case to try to prevent an outbreak like what we experienced in Ebola. And I think there might be a little bit of a disconnect if the proposal is that that donors will pay 100% of the insurance premiums for IDA-assisted or for low-income countries. It seems like there needs to be some kind of a link in there to those country governments to invest in preparedness. So I think that's something that would have to be explored. And the other part that I think would have to be explored is that for a parameter or for a trigger to happen, one of the most important inputs for that is going to be timely and accurate data. And that's exactly what we didn't have in the beginning of the Ebola outbreak, is timely and accurate data. So a very big concern would be how to ensure that that is being addressed. And then I think, as others have said over the course of this morning, the premise of having a new facility is that rapid access to money, that rapid access to cash was very much a limiting factor in the Ebola response. And I think we should consider how accurate that is and for what parts of the Ebola response, because I'm not sure that it was uniformly a question of lack of access to money across the board in mounting that response, and was different maybe in different places and particularly in different aspects. But I think there were a lot of logistical and managerial aspects that were big constraints in the response, irrespective of money. So I think that's something we need to take into account as well.
Thank you. I think very last, if it's very quick.
Yeah, sure. Thank you. This was mentioned a couple of times by Olivier and the others about contingent funds that the government already has for its emergency response, because this is what we are in effect trying to finance, is the response to stop an epidemic from getting larger. And is it, some of this should be perhaps self-financed by governments, because it's an emergency response, and there has to be some provision to execute it. And have we been giving advice? I mean, we, meaning our institutions, including perhaps the IMF, about how much should our client countries be budgeting for responses to the risks that they face. Now we see that they also risk the epidemic risk is there. Maybe it wasn't included explicitly, but we have done such work for other hazards, and it wouldn't be hard to do it for this. And so how are we advising some minimum funds for contingencies? Perhaps?
Yeah, I'm going to let Olivier.
Just in a few words, I think it's a very important point, and fiscal discipline at the end of the day is the most important thing. So if you can help government to set up and to have some contingency budget available when it is a strikes, particularly to cover the first weeks, I think that's the best use of money. And I would say, to some extent, to be a bit provocative, insurance for me will be a second best solution. This is because government cannot really set aside some contingency fund. They have to maybe finance that through some other instruments, at least for the first immediate response. So some countries, and again, Mexico is a good example, have now in their budget, as far as I know, a line dedicated for disaster risk management. And other countries now are working toward this kind of embedding, in fact, this kind of needs into their budget. So I think this is definitely a very important point, and I think the same will apply for pandemics. So while we can talk a lot about, I would say, sexy and very innovative products, at the end of the day, some very basic tasks, very basic actions to be made on the fiscal budget could also help maybe countries to answer quickly their emergency needs, at least for the first weeks.
I mean, and there the insurance helps in order, almost like a stop loss on the budget. So if it goes expenses way above what is budgeted, then you have insurance. And Mexican government actually does use insurance for this when losses go for very high. So I think we came up to the time. I think we're about 3 minutes over, but it was a great discussion, a very rich discussion. And I think a lot of these themes that we have been discussing now will continue in the next 2 panels that we have after lunch. So I think it's a very good segue, and we built a storyline throughout the day. Thank you very much for your questions and attending. Thank you, Gunther, also for your patience.